You are dispatched for a one-car MVC in front of the LCCC North Bridgeville campus. Upon arrival, you find a four-door sedan that hit the sign in front of the entrance to the campus. There is moderate damage to the front driver's side of the vehicle. A patient is awake, alert, and they had self-extricated prior to arrival. Patient is found lying supine on the ground outside of his vehicle. Upon arrival, the patient is awake and alert. He's approximately 30 years old. There is front end airbag deployment. The patient was wearing a seatbelt, and the patient is complaining of left ankle pain.
Okay, so I'm on scene, checking my scene for safety. You said that the scene is controlled.
Correct. PD's on scene. They've cleared traffic for you.
Awesome. Is fire also on scene?
Yes, they're just arriving now.
All right, great. So I'll have on my proper PPE, which will include my gloves and anything else that I need for this particular situation. And you said that there was moderate damage to the vehicle?
Yes, front end damage.
Any scarring of the windshield or deformity of the steering wheel?
Both negative?
And you said that he was wearing a seatbelt and
Correct.
self-extricated?
Yes.
Okay, so I'm going to approach my patient, and can you tell me what I'm seeing as I'm looking at my patient?
Yes, so one patient found outside of his vehicle laying supine. He is awake and alert, able to answer your questions appropriately. No outward signs of bleeding that you see coming on scene.
Okay, and you said there's just one patient, and are there any other hazards where I would need any additional resources?
Yes, just one patient and no other hazards on
Okay,
scene.
perfect. So I'll approach my patient and talk to him. Hey, sir, can you hear me? My name's Dawn, and I'd like you to hold still while I assess you. I'm a paramedic.
Okay.
All right. So can you tell me what happened?
I was in a car accident.
Okay, and did you lose any consciousness, or do you have any time where you feel like you blacked out?
No, I remember it.
Okay, all right, so he's alert and oriented. He's alert to verbal, or just already alert. So as far as my AVPU goes, I would give him alert.
Okay.
And we're going to, while I'm here holding C-spine, I'm going to take a look at his airway. When he was talking to me, was it his airway patent and clear?
Yeah, airways patent and clear. Patient is speaking without difficulty.
Okay, and I don't hear any gurgling or anything?
Correct.
All right, perfect. And as I'm looking down the chest, do I have equal chest rise and fall?
Yes, equal chest rise and fall.
And his breathing rate?
He's breathing about 16 times a minute.
His quality of the breathing?
It is adequate.
Okay, all right, very good. Well, just based on the fact that it's a trauma, I'm gonna go ahead and give him nasal cannula 2 liters per minute. And then we'll assess it as we go from there, and I'm going to pass off C-spine to my partner.
Okay.
All right. So I passed off C-spine to my partner. I'm going to come down and check to see that the trachea is midline.
So trachea is midline.
All right, does he have any JVD?
Negative.
And I'm gonna check the back.
No.
Do you have pain there?
Yes.
Okay, so he has some pain on palpation to the back of his neck, but I'm not feeling any step-offs or any decap PTLS?
Correct. No step-offs noted to the spine.
Perfect. Okay, so since I'm here, I'm just gonna go ahead and have my partner put a C-collar on him.
Okay.
My other partner. All right, and now I'm going to go down and expose the chest.
Okay.
All right, I'm gonna check the chest for decap BTLS, and I'm feeling for equal chest rise and fall.
Equal chest.
Sorry.
No. Equal chest rise and fall is present. There's no decap ETLS noted to the chest.
Okay, and does this hurt at all?
No.
Okay, all right, so checked airway and breathing. We're gonna check circulation. Just checking for a pulse. How's my radial pulse?
Radial pulse is strong.
Okay, and skin color, temperature, and condition?
Patient's skin is pink, warm, and dry.
All right, very good. Well, based on his complaints of neck pain and his situation, this is going to be a load and go. We're going to take him to a trauma center.
Okay.
So I'm going to ask my other partner to go get a backboard while I continue with my assessments.
All right.
All right, so I'm going to check the abdomen, all 4 quadrants.
Abdomen is soft, not tender. No decap BTLS is noted.
Perfect. I'm going to check my pelvis for decap BTLS and any tenderness, instability, or crepitus.
No crepitus. Pelvis is stable. No decap BTLS noted.
All right, I do that by pushing in and down, and then I'm going to go down each leg. I'm checking over the femur to see if, and as I'm doing that, I'm pulling my hand out from the bottom occasionally just to see if there's any blood or fluids that I didn't notice before.
Okay.
So looking for decap BTLS over the femur,
Negative.
patella,
Negative.
tib fib,
Negative.
and tarsals, metatarsals, phalanges.
Negative.
And do I have a pulse?
Yes, you do.
Can you feel this?
Mm-hmm.
And can you wiggle your toes?
Yes.
we would be exposing as we go.
Okay.
Alright, and did you say, skin color, temperature, and condition down here?
Pink, warm, and dry.
Warm and dry, perfect, thank you. And I'm going to go through the other leg, I'm going to check over the femur.
Femur's
Again,
clear.
checking for any fluids or anything, over the patella.
Clear.
And on the tib fib, he's expressing some pain, do I notice any deformity?
Yes, patient has positive deformity to the right lower leg.
Okay, and, as far as, MSPs, does he have a pulse?
He does have a pulse.
And his skin color and temperature and condition?
Pink, warm, dry.
And can you feel this?
Yes.
Okay, alright, so we're just gonna note that, possible fracture there for now.
All right.
We're gonna go up and check our upper extremities, checking the scapula and the clavicle, for decap BTLS.
Both negative.
Going down the humerus,
Negative.
radius ulna,
Negative.
carpals, metacarpals, phalanges.
Negative.
Checking for a pulse,
Present.
and skin color, temperature, and condition.
Pink, warm, dry.
Can you wiggle your fingers, and can you feel me touching you?
Yes.
Okay, we're gonna check the other side. Again, scapula, clavicle,
Clear.
going down the humerus,
Clear.
radius ulna.
That hurts.
Alright, so it hurts in his wrist area. Do I notice any decap BTLS?
Yes, patient does have positive deformity to the right lower arm.
Okay, and so do we have a pulse present?
Yes.
And skin color, temperature, and condition?
Pink, warm, dry. Cap refill is normal.
Can you squeeze my fingers? And can you feel me touching you?
Yes.
Okay, alright, so we're gonna note that fracture as well.
Okay.
At this point, my partner's back with the backboard.
Mm-hmm.
So we're going to roll the patient to check his back and then place him on the backboard.
Okay.
We're going to do so on the head person's count, so that we work together.
Mhm.
So, and I'll have my other patient, or my other partner also helping me with rolling him.
Okay.
We're gonna take care to not move, his extremities that have issues as much as possible.
Okay.
Alright, so, head person's count, 1, 2, 3, we're rolling to the side.
Mhm.
We're checking the back of the head.
Clear. BNA decap BTLS.
Alright, we have that C counter on, but do I see anything
No.
through there?
Negative.
We're going down the spine,
All clear.
the buttocks,
Clear.
down the back of each leg.
Clear.
Okay, so we're going to, again on the head person's count, roll him onto the backboard.
Okay.
1, 2, 3, onto the backboard.
Mhm.
Make any adjustments along the, keeping him in line as
Okay.
possible, and then securing him to the backboard, nipples, navels, knees, and then head blocks.
Okay.
And we're going to get him into the back of the squad since this is a loaded go and take him to trauma center. Once we're in the back of the squad, we're going to get a sample history, and full set of vitals.
Okay. Patient has no history that he knows of, no medications he takes, no known drug allergies. Initial vitals are blood pressure 138/76, heart rate 110, SpO2 98%, and respiratory are 16.
Okay, so based on that, I believe our oxygen is managing him appropriately,
Okay.
with his O2 sats and his vitals. When did he last eat?
About an hour ago, he said he had some lunch.
Okay, very good. So, and no past medical history or any allergies or any medications are
Correct.
set there. And what would you describe the pain in your neck as on a scale of 1 to 10? If you had to give it a 0 to 10, if you had to give it a number, 10 being the worst.
8.
An 8, okay, and in your right leg?
7.
7, and in your right wrist?
7.
7, okay, so we have that assessed. If we're a medic unit, we'd also put them on the heart monitor and start an IV, draw bloods, and initiate fluids if necessary.
Okay.
All right, now we'll go back over and start our secondary a little bit more in detail.
Mhm.
We're going to check over the bones of the skull, so we're going through the frontal, parietal, occipital, and temporal regions.
All clear of any decap BTLS.
We're looking in the eyes, checking the pupils to see if they're pearl, or
pupils are-
pupils are equal, round, and reactive to light.
Correct, pupils are pearl.
Okay, and looking into the nose to see if there's any fluids.
Negative for fluids.
Looking in the mouth to see if there's any blood or fluids, or if the teeth are all intact, if there's anything missing out of the tongue.
Teeth are all intact and negative for fluids.
And airway still patent.
Correct?
Checking the ears to see if there's any fluid, also checking for battle signs.
Fluid negative and battle signs are negative as
Alright.
well.
Going back down, reassessing the trachea.
Okay.
Is it still midline?
Yes.
Any JVD noted?
Negative.
Alright, going through, checking breathing. Do I still have equal chest rise and fall?
You do?
Do I notice any other instability or crepitus?
Negative.
Any complaints of pain as I'm touching you? Please let me know.
No.
Alright, got another call. So then we are gonna check the abdomen again, checking all four quadrants.
Abdomen is soft, not tender, no distension noted.
Nothing in the pelvis, we've already checked that.
Track stable.
Just assessing. Then going down the legs just to make sure we haven't missed anything, going over the femur, the patella, tibia, fibia, tarsos, metatarsals, phalanges.
All negative on the left side,
Pulse is present.
correct?
Sir, can you feel this?
Yes,
Can you wiggle your toes?
yes,
Skin color, temperature, and condition?
Pink, warm, dry.
Alright, going back down the other leg, I know that we have this deformity here in the lower leg, so we're not going to repalpate that, but in the femur,
Femur's clear,
patella,
clear.
okay, and so at this point, we'll probably splint this injury here since we have some time.
Yes.
Checking pulses,
Present.
and sir, can you feel this?
yes,
And can you wiggle your toes?
yes,
Alright, very good, and skin color, temperature, and condition on this leg?
Pink, warm, dry.
Alright, very good. Then we'll go back up. Checking decaf BTLS again.
Negative on the
Alright.
left side,
Skin color, temperature, and condition.
pink, warm,
Can
dry.
you wiggle your fingers?
yes,
And pulse present?
Yes.
Alright. And can you feel me touching you?
yes,
Okay. So going down the other side, over the humerus, radius ulna. We have that injury here, so we're gonna take that time to split that now.
Okay.
And after the splitting, do we have a pulse?
Yes, pulses are present.
And skin color, temperature, and condition?
That's pale, but warm and dry.
And can you wiggle your fingers?
yes,
Can you feel me touching you?
yes.
Okay. All right, so we've done our reassessment. We're going to continue to reassess our patient since he is stable at this time. We're going to reassess him every 15 minutes. If he were to become unstable, we would reassess him every 5 minutes.
Alrighty, very good.
All right, thank you.
Mhm.